What are the best supplements for osteoarthritis? As a physical therapist, I get that question from patients a lot, and I figured you may want to know the answer to it as well. But I am a physical therapist, not a dietitian or a pharmacist. And so instead of sharing my personal opinions, I wanted to share with you the best available evidence from medical literature. And so to do that, I'm going to show you the results of a systematic review. And what a systematic review is where they take all the available evidence at the time of the study and they review it for quality, and then they pool all the results. So the results you're getting from this are the best of the best. And they found 9 different supplements that were good for osteoarthritis that had large effect sizes and were shown to be statistically relevant to help improve osteoarthritis pain. They also found some that were not effective. And so I want to first share with you, before we go into the most effective supplements for osteoarthritis, the ones that were well known but not effective. So glucosamine and chondroitin are probably the most well-known arthritis supplements, and they've been studied for years with varying results. Some studies show that they help some studies show that they don't help, but when they pulled the overall results, their conclusion was widely used supplements such as glucosamine and chondroitin were either ineffective or they showed such small effect sizes and are possibly clinically unimportant. And so what that means is that even when they found that there were effective, the effect was so small that it wasn't really going to affect you in your everyday life. And so if you're wondering if you should use glucosamine and chondroitin, while they're probably not bad for you, you could probably better spend your money on other things. And these next 9 supplements are things that they found that are actually shown to be effective. So there are short-term effects, medium-term effects, and long-term effects that they looked at in this study. And the short-term effects were the ones that by far had the most supplements that showed some benefit. And when you think about it, they're really kind of like taking an ibuprofen or an Aleve. Most of them work on an anti-inflammatory basis. And so they're mostly going to be short-term anti-inflammatory effects that you get. But when your knee's hurting or when your hip's hurting, it may not hurt to have anti-inflammatories. And these are more natural. So if you do prefer more natural things than synthetically made medications, you may look at some of these ones that were shown to be effective. And if you look at the graph over on the side of the screen, you'll see a solid black line running down. And I think it's going to be on the right. It says favors placebo and then favors supplements. You'll see most of them favored the supplements to some small effect. But the dotted line that runs next to it, if it's between the solid line and the dotted line, it means that the effect is really small and it probably doesn't help all that much. And then the bars that kind of run outside of those squares that you see, those are sort of the standard deviations, or they say the 95% confidence interval, meaning if it crosses one of the lines, it's still probably not, you can't say with 95% confidence that it's helpful. And so I'll go into the 9 supplements that were most effective. 7 of them were effective at short term, 2 of them effective at medium term, and none of them were really all that effective in the long term, meaning greater than 6 months. So the first one is Boswellia serrata. That is basically frankincense. So this has been used long time ago. If you remember back to the Bible, the 3 wise men brought gold, frankincense, and myrrh. Well, frankincense is basically Boswellia. And so it's derived from the Boswellia serrata tree, and its effects are mostly anti-inflammatory effects. So it can be helpful for reducing arthritis, again, in the short term, less than 3 months. And generally, the recommended dosage is around 150 to 250 milligrams daily. For the dosages, I did pull these off of WebMD, so these aren't my personal recommendations. And I am going to put some pictures and some links in the description to the supplements that I mentioned. But these are by no means the only brand or the best brand or the best brand for you. So just a note, talk to your doctor about how any supplement may affect you personally. But these are just the results that the literature showed in general for most people. The next one is pycnogenol, and this is extracted from the bark of the French maritime pine tree. This shows pretty large clinically important effects But again, they're short-term effects. And again, it's an anti-inflammatory and an antioxidant. So it's sort of like taking an anti-inflammatory, but it's a more natural form that comes from the bark of a tree. And the recommended daily dosage is around 100 milligrams per day. The next effect, this one is probably one of the most well-known anti-inflammatories or natural anti-inflammatory supplements, and that's curcumin. Curcumin is basically the active ingredient in turmeric, but you'd have to eat a whole lot of turmeric, several tablespoons to a cup of raw turmeric per day to get the effective dose. And so you really probably want to supplement if you're going to use it rather than trying to get enough in the natural form. There is evidence that when you add black pepper to turmeric as well, it makes it a little better absorbed and makes it work a little bit better. So if you are looking for a supplement, look for one that has both curcumin and black pepper. And the dosages on those are around 500 to 2,000 milligrams per day. The next one is ALCcarnitine. L-carnitine is an amino acid, but it's one that your body actually produces. It's produced in your liver and your kidneys from lysine and methionine. So you can actually synthesize it yourself if you have enough of those two amino acids. It's not necessarily one you have to take in from your diet. L-carnitine is also a well-known diet supplement because it does help mobilize fatty acids to be burned for energy. And so that's another use. And if you are looking to lose some weight to help with your arthritis pain, that may be one that can be helpful as well. But again, talk to your doctor about which ones may be helpful for you because chances are you probably don't need to take all 9 of these different supplements. The recommended dosage is around 2 grams per day for adults. The next one is passion fruit peel extract. And this is one that actually had a pretty large effect size, but again, short-term effects. And the specific mechanism isn't really known, but it doesn't really matter why it works. If it works, and it works pretty well. And the dosage is about 250 to 900 milligrams per day. The next one is collagen hydrolysate. And this one was actually the largest effect size of the short-term effects. And collagen is the structure that your cartilage is made out of. But the hydrolyzed form of collagen is broken down so that your body can absorb it a little bit more easily. And it's thought that this collagen helps to actually rebuild the cartilage. But again, these were shown to have effects of 3 months or less. So it doesn't necessarily mean that you regenerate cartilage on a permanent basis. And the dosage recommended for this was 2.5 to 10 grams per day if you are going to take it. The final one is MSM for the short-term effects. And MSM is an acronym for methylsulfonylmethane. You can see why they call it MSM because that's quite a mouthful. Pretty much everyone refers to it as MSM. MSM is commonly used together with chondroitin and glucosamine. And so if you are going to use glucosamine and chondroitin, it is helpful to put MSM along with it. There is some sort of a synergistic effect, and they are supposed to work better together than separately. But again, if you're looking to kind of save your money and invest in the most effective products according to research, glucosamine and chondroitin are probably not up there. So this one that I linked to in the description, the picture you see on the screen, this is a pure MSM product, but you can find blends of glucosamine, chondroitin, and MSM together. And again, MSM is known for its anti-inflammatory effects, and the recommended daily dosage is about 1,500 milligrams per day. Now, moving on to the medium-term effects, these were the ones that helped in the 4 to 6 month range. So a little bit longer than the previous ones, but there were fewer, as you can see from the bars, that actually had any effect. The 2 that showed up as being relevant and effective were the Greenlipped muscle extract and undenatured type 2 collagen. So we'll cover that one first since we just talked about collagen extract. You can see here down at the bottom on the long-term effects, the only one that really had any significant overall effect was chondroitin and vitamin D, but those effect sizes were so small that they really, if they did have any effect, you wouldn't notice them practically in your everyday life. So no supplements really helped in the long term, and that makes sense because supplements are just that. They're supplements. They're not to be used alone. They're to supplement the other things you do, which is largely a good diet and a good exercise program. The next one is undenatured type 2 collagen, and your joints are made up of type 2 collagen, or rather, the cartilage in your joints is made up of type 2 collagen. This has both an anti-inflammatory effect. It also has sort of an immune effect. So this one may actually be helpful for rheumatoid arthritis as well as osteoarthritis. And the dosages range from 40 milligrams per day to 120 milligrams per day. Now, unlike the hydrolyzed form of collagen, this is the collagen in its full form, kind of the way that you would find it in your joints. The last supplement is Greenlipped muscle extract, and this is derived from mussels from New Zealand. It's known to have some compounds that have anti-inflammatory properties, but unlike some of the other anti-inflammatory supplements, this one did show to have a little bit longer effects over the 4 to 6 month period. The daily dosages of these are 500 to 1500 milligrams per day. So those were the 9 supplements. I did put links in the description where you can get the products that you saw on the slide on Amazon. Again, you probably don't need all 9, and these aren't the only brands or necessarily the best brands. I did put links to the Thorne brand where possible, and this isn't a sponsored video, but they are a well-known, trusted, and third-party tested brand. And so when you do see a brand that's tested by either NSF or USP, it has a little bit more credibility because the supplement industry is highly unregulated. Again, it's also important to check with your doctor as far as how supplements affect your health, and use the supplements in conjunction with a proper diet and exercise program. And if you do need more tips or exercises to help improve your arthritis pain and avoid a knee replacement, we've got plenty of those here on the channel. So make sure to give this video a like and subscribe to our channel so you can get notified of our future videos. And here are a few other videos that'll help you with your knee arthritis pain.